Hi everybody, it's Dr. Newman. During my conversations about breast augmentation, patients frequently are asking about their ability to breastfeed after the surgery. And the distinction between over-the-muscle surgery and under-the-muscle surgery or under-the-muscle implant placement. When we put implants in under the muscle, we think of it more like it's muscle surgery rather than breast surgery. So typically you're not operating on somebody anywhere near their milk ducts and their nipple and the whole mechanism through which breastfeeding happens. All of that is within the breast tissue, which sits over the muscle, yet we're placing the implant in from under the muscle. This is one of the reasons why I typically don't like the approach of putting an implant in through an areola incision. Because when you operate near the nipple and you make incisions that go through the breast tissue, then technically you can affect it. And theoretically, anytime you operate on anything, you potentially can affect its function. But with an under the breast approach and an under the muscle implant placement, it's very unusual in my experience to affect somebody's ability to breastfeed. It's very unusual in my experience to affect somebody's sensation, as long as you know the anatomy and you know where the implant placement needs to be and you know what areas are safe and what areas are not safe. In my experience, it's very unusual for a patient to lose sensation or the ability to breastfeed simply from breast augmentation. Now, this changes a little bit when somebody has a breast lift done because now they're having surgery that involves incisions around the nipple. And that's a whole other conversation, which can potentially affect the ability to nurse and the ability to feel your nipple and to have good nipple sensation. Although there are things that I, as a surgeon, do during the surgery to try to ensure that those changes don't happen.